Hello friends, let's begin this radiology. A few important points. So first picture, this is what osteoclastoma, also known as giant cell tumor. So we see this this extrinsic expansile and lobulated lytic lesions. This is metaphyseal lesions, but it is extending to the joint, to the joint, and up to epiphysis. It is not limited to metaphysis. So this is a giant cell tumor, and age group is 20 to 45 years. This is benign bone tumor, but it is locally aggressive. Next image is this is a barium enema. It is showing what sawtooth appearance of transverse ascending transverse and descending colons. Okay, so this is a colonic diverticulosis. Here intraluminal pressure is too much high. So what can be the clinical vignette given? So old male patient is visiting OPD and complaining of altered bowel habit, painless rectal bleed, abdominal cramp. Okay, patient is habitual of high fat diet and low fiber. Such patient is has the risk of developing colonic diverticulosis. Okay, this colonic diverticulosis is false diverticula. Why? Because mucosa and muscularis mucosa is involved. It is usually post 50 year, and it can involve ascending transverse and descending colon. Next one is this image is showing the C2 vertebra. This is spinous process is avulse. So this is hangman fracture, but it is not only seen in judicial hanging. It can be in it can be seen in RTA also, or any other kind of cervical trauma. So there is anterior translation of C2 vertebra, and neurological injury is not common in this patient. Why this is a fracture? What is the mechanism? Hyperextension force. Next one. So this image is showing a clinical vignette is saying 38-year-old male coughing, joint pain, and both cheek are swelled, and patient is having erythema nodosum. So this is the most probably diagnosis is this sarcoidosis. What is sarcoidosis? It is non-caseating granuloma disease. Okay, this is multi-system involvement is seen in sarcoidosis. Etiology is unknown. In X-ray of chest in sarcoidosis, bilateral hilar lymphadenopathy is seen. In blood, hypercalcemia is seen. Lofgren syndrome is one of manifestation of this sarcoidosis. What is Lofgren syndrome? It is arthritis with erythema nodosum with bilateral hilar lymphadenopathy. X-ray chest can be used for staging of sarcoidosis. Okay, next image is showing this anatomical diagram bones of foot. So this is the transverse tarsal joint. The amputation along with this is known as jaw part amputation, and distal to this is this one tarsometatarsal joint, and the amputation through this is known as Lisfranc amputation. So next photo is this odontoid bone fracture. Odontoid bone process of a C2 vertebra is known as odontoid. So this bone, this part of C2 vertebra is fractured. It can be type 1, 2 and 3. Type 1 is just only a small part of odontoid bone. This is a avulsion of tip, only tip. So this is stable fracture. Second is unstable. Why? This involves a fracture of base of dens. That's why it is unstable, and it is most common too. Type 3 odontoid fracture is the fracture at junction of odontoid bone with a body of C2 vertebra. Now this X-ray abdomen of lady is showing misplaced IUCD. So this is IUCD and this is misplaced. So this can lead to perforation of uterine and further peritonitis. So this is so how this can be managed. Laparotomy, remove this by laparotomy. Copper T removal by laparotomy. Next image is this we see cubital valgus. We see cubital valgus. We see cubital valgus of this patient. So what are the condition? How this happens? Lateral condylar fracture that can lead to non-union of the bone, that can lead to cubital valgus. Okay, and what can furthermore this can cause stretching of ulnar nerves, and it can that will lead to paresthesia along ulnar nerve distribution. This condition is known as tardy ulnar nerve palsy. Next two radiograph. First is showing neurogenic bladder. So this is the neurogenic bladder. How this appears? Christmas tree or pine cone appearance, and this happens due to increased bladder sphincter tone. Next, this is the thimble bladder. This is a small contracted bladder, can be seen in bladder tuberculosis. This happens due to fibrosis of bladder wall. Next and last image is the hemangioma. This vertebra is showing the corduroy appearance, and the vertebral body is the most common site of hemangioma. This is benign tumor, and on axial CT, this will show polka dot appearance just like this, and usually patient do not require any intervention, but aggressive case can be treated with vertebroplasty. So friend, thank you very much. Please like and subscribe my channel.